Nasopharyngeal cancer, causes, symptoms, and prevention. 1. Causes. Nasopharyngeal carcinoma is a type of cancer that originates from cells in the nasopharynx, the upper part of the throat, behind the nose. The main causes and risk factors include Epstein-Barr virus, EBV. This virus is closely related to nasopharyngeal cancer, especially in people with chronic EBV infection. Genetic and ethnic factors. More common in people of Southeast Asian descent, especially Vietnamese and Chinese Southern people. A family history of nasopharyngeal cancer increases the risk. Dietary habits. Consuming a lot of salted, fermented foods, salted fish, pickles, or foods containing nitrosamines, carcinogens. Smoking and drinking alcohol. Smoking and drinking alcohol regularly increases the risk of damage to the nasopharyngeal mucosa. Exposure to toxic chemicals. Wood dust, formaldehyde, or industrial chemicals may increase the risk. Living environment. Living in a polluted area or long-term exposure to dust. 2. Symptoms. Nasopharyngeal cancer in the early stages often has no obvious symptoms and is easily confused with common diseases. Common symptoms include nasal symptoms. Prolonged nasal congestion, usually one-sided, mild nosebleeds or bloody nasal discharge. Ear symptoms. Tinnitus, hearing loss, usually one-sided, or a feeling of fullness in the ear due to the tumor compressing the ear canal. Neck symptoms. Swollen lymph nodes in the neck due to lymph node metastasis. The lymph nodes are usually painless and hard. Throat symptoms. Prolonged sore throat, difficulty swallowing, or feeling of something stuck in the throat. Neurological symptoms. Late stage. Headache, blurred vision, facial numbness, or cranial nerve palsy due to tumor spread. Systemic symptoms. Unexplained weight loss, fatigue, prolonged low-grade fever. Note: if you have symptoms such as nasal congestion, tinnitus, or swollen lymph nodes lasting more than 2 to 3 weeks, you should see an ENT doctor immediately for a checkup. 3. Effective prevention. Although nasopharyngeal cancer cannot be completely prevented, the following measures can reduce the risk. 1. Limit salted and fermented foods. Reduce consumption of salted fish, pickles, or foods containing nitrosamine. Increase intake of green vegetables and fresh fruits to supplement antioxidants. 2. Quit smoking and limit alcohol. Quit smoking completely and reduce alcohol consumption to protect the nasopharyngeal mucosa. Avoid exposure to secondhand smoke. 3. Protect from toxic chemicals. Use masks and protective equipment when working in environments with wood dust, formaldehyde, or industrial chemicals. Ensure a well-ventilated working environment. 4. Maintain a healthy lifestyle. Eat a balanced diet rich in vitamins A, C, and E, found in vegetables and fruits, to strengthen the immune system. Exercise regularly, 30 minutes, day, 5 days, week, and maintain a healthy weight. 5. Control EBV infection. There is currently no vaccine to prevent EBV, but maintaining a healthy immune system helps reduce the risk of chronic infection. Avoid contact with secretions, saliva, of people infected with EBV. 6. Regular health checkups. People at high risk, family history, living in high endemic areas such as Vietnam, should have regular ENT checkups, nasopharyngeal endoscopy to detect abnormalities early. Blood test for EBV antibodies, IgA anti-VCA, IgA anti-EA, if prescribed by a doctor. If you have symptoms such as nasal congestion, tinnitus, or neck lymph nodes, you should see a doctor immediately. Note: early detection. Early-stage nasopharyngeal cancer has a high cure rate, 70 to 90%. Endoscopy and biopsy are the correct diagnosis. Thank you for watching the video. Wish you and your family health and happiness.